All right, thanks. Hi, my name is Shaina Patel, and my topic of study is general surgery. A lot of people don't choose to choose the path of surgery because it takes a really, really long time. The minimum is usually about at least 13 or 14 years because you have to do your undergrad and then 4 years of med school, and then after that you do your residency, which is actually the longest residency for the whole entire medical field. It's usually at least 5 years, and then if you want to specialize, it's another 1 or 2 years for your fellowship. But Winston Churchill once said, "Success is not final, failure is not fatal, it is the courage to continue that counts." This quote has been really inspiring because basically it's just told me that no matter how long the path is or what I encounter, I need to just keep on going because it's what I really want to do. I chose ISM this year because I really wanted to get out of my comfort zone, and I knew that if I took ISM, I would be meeting with professionals and getting an internship, and I really wanted to see if I really wanted to pursue surgery. And I chose surgery because I've always wanted to be a doctor ever since I was younger, and last year I did anatomy and physiology, and I just loved it, so I thought I wanted to do the field that was the most connected to anatomy and physiology and really have a big impact in people's lives. So basically what I've been doing so far is I've been trying to talk to different specialty people. So for all of my interviews, every time it's been with someone that's like a different kind of surgeon to see if there's one that I specifically like. But so far, I'm not sure what I want to go farther into, so I'm sticking to general surgery. My mission statement is, my mission in ISM is to broaden my knowledge in the field of general surgery. With the help of a mentor, I will design a product utilizing the information and skills I have learned while studying this career. I hope to learn different aspects of the medical world and witness surgeries to prepare myself for a future occupation in medicine and better prepare myself for the vigorous road ahead. So I had a lot of interviews. There's still a few more, but these are the really significant ones. The first one I had was with a plastic surgeon named Dr. Jeff Angubaldo. Basically, everyone that I interviewed kind of talked about the same thing, but different things at the same time. They all told me about the path that you have to go through to become a surgeon. Basically, you go do your undergrad. It really doesn't matter what you major in or where you go. Then you go to med school, and then you specialize in surgery. Then you have to apply for residency, and you kind of just go wherever you get in, because it is really hard to get into these kind of programs and stuff. And then if you want to specialize, you do 1 or 2 more years doing a fellowship. So they all kind of talked about that and basically what they do in their general lives, which includes not just operating, but speaking to patients every day and diagnosing them and knowing how to do basic procedures. So they kind of taught me that surgery is a really, really expansive field because you're not just in the operating room isolated cutting people open. You're interacting with people every day, and you get to do a really big variety of things rather than staying centered on one specific procedure the whole time. So Dr. Angubaldo taught me that you have to be confident. In all honesty, he was a little overconfident, but some people just need that because if you're not confident, like Bryson was saying, you're not going to go far because you have to know what you're doing. And he taught me that as you go farther in your field, you're going to learn more and more, and you're going to get better and better. Dr. Shaina Patel is a general surgeon. She taught me that everything nowadays for general surgery is extremely subspecialized, especially because we live in Frisco and it's really urbanized. So you have to really go farther in depth to what you really want to do, and you have to decide that when you're doing your residency and everything. And she also taught me that it's not impossible to be a woman and be a surgeon at the same time. A lot of people think that surgeons can't have children or families or lives outside of work, but that's actually not true. If you work hard enough, you can have both. Dr. Keith Cavanes is a surgical oncologist. He taught me more about surgical oncology in general and about tumor removals, and he also taught me a really important thing that I needed to know. It was that if you go to a more rural environment, there's going to be a lot more variety for general surgeons. But if you're in a place like Frisco, you're going to have to be extremely specific with what kind of operations you're doing and stuff like that. So that kind of made me think about where I want to go. Because personally, I'm more of a kind of person that wants more variety. Dr. Alan Barber, he is an orthopedic surgeon. He taught me that school is extremely important. Although it's not your entire life, it is a huge part of it. So you need to make sure that you're making the grades, that you're doing well on tests, on your exams and everything, and that you have to keep yourself centered while you're going through this path, and you can't get discouraged, because if you get discouraged, then you're not going to want to continue. But it's all worth it in the end. Dr. Kim Rickert, actually, she's a neurosurgeon, and she had one of the biggest impacts on me because her story was just so unique. She actually had a child in high school when she was 16 years old. From that, she went to teaching, and then she got her undergrad. From that, she went to more teaching, and then she got her PhD eventually. And then she thought, you know what, why don't I try out med school? And at this point, her kid was already a teenager, basically. And she did really well in med school. And then she did her residency and everything. And by the time she was in residency, her daughter was already in college. So she didn't exactly have to worry about taking care of her the whole time. And she's come out amazingly, because now she's the chief of neurosurgery at Parkland. So that was definitely a really big inspiring factor to hear her story, to hear that she came from having a kid in high school to becoming the chief of neurosurgery. So it's people like that that I was looking for to really help me learn and stuff like that. Dr. Peter Kim is a transplant surgeon. I actually interviewed him over the phone because he was kind of far away, but he did teach me that it's really important to take risks in this field. If you just stay extremely comfortable doing what you know how to do already, you're not going to go farther. You have to try new things and learn new things from people, from your colleagues around you. And lastly, I met with Dr. Robert Minquez this morning, actually. He's a pediatric surgeon. He taught me that pediatrics is a lot more broad than just surgery on adults, because as a general pediatric surgeon, he does all kinds of surgeries. He does tumor removals, hemorrhoids, just everything. But as a general surgeon for adults, it's extremely subspecialized. So this kind of made me want to go more into pediatrics, because not only do you get to work with kids, but you get to do a lot more variety, because he also does ER shifts and stuff like that. My first research assessment was over common surgical procedures, basically about what I need to learn going into the medical field, things that every surgeon has to know how to do, and not just surgical operations. I learned that there is a lot to it, and you have to know a lot going in, and you have to really perfect these things. One of my second ones was, it was initially about gastrointestinal tumors, which basically means tumors that are in your stomach and intestinal area. But what I really learned from this a lot, not just about the tumors, was about case studies. So I realized that, and also the people that I interviewed told me a lot about this, I realized that a lot of doctors take time off to do research in between their undergrad and med school, and some people do it while they're a doctor also. But case studies take a long, long time. If you want to participate in research and trials and stuff, it takes several patients to test on. A lot of times over 40 or 50, it takes several months to go through. So it's a long, rigorous process, and then eventually you get published, and it involves collaboration with a lot of different people. So you have to be really open to working with the people around you, and you have to be innovative, and basically you should strive to find new breakthroughs. And even though it's a long process, you would have an impact on someone's life, so it's something that you should strive for. One of my other research topics was on robotic-assisted surgery. So I did actually a lot of extensive research on this. Basically, if you guys are familiar with laparoscopic surgery, it's kind of similar to that. Laparoscopic surgery is basically minimally invasive, so it's when they have these tools and they get inside your body to do really, really small incisions. So with laparoscopic surgery, picture yourself with chopsticks and going inside someone's body and making tiny little cuts. But then with a robotic machine, it's kind of like the same thing, only the chopsticks have wrists and fingers so they can move in different ways. So instead of having to come at a different angle and turn, you can just turn it by yourself and cut whatever you need to cut. So it's a lot more flexible than just laparoscopic. So that kind of opened me up to the world of modern medicine. People are using stuff like this every single day in general surgery and a lot of different other fields because it's just more flexible to their use. So this kind of taught me that everything in the medical world is always changing. It's always moving forward. So as a really young person right now, this is what I'm going to be using when I grow up. So, and another thing that Dr. Minka said, you have to keep up with the technology that's going on today and as it evolves, because if you just skip out on it, then you're not going to know how to work anything that's coming next. So you have to be really up to date on that kind of stuff. One of my other research assessments was on the UNT trip. So the first class that I went to was play therapy. Basically they were talking about how, kind of like how Katie was saying, young kids can get comfort out of maybe like playing with a toy, and they should be encouraged to do things that they can do themselves. But this didn't really appeal to me that much. I just kind of went because I was looking for a class, to be honest. But the second class I went to was a biochemistry class. So I'm sure that nobody knows what this thing is on the screen. It looks totally weird, and it just goes to show that when you go into the medical field, you have to study so extensively. This is actually a lectin, which basically is a protein that binds carbohydrates together like really deep inside your body. So this kind of like opened my eyes to show me that even in just one class, biochemistry, you go so in depth with the human body, and you can't just skip out on this kind of stuff. So it's a very long road, and you have to learn a lot of little things like what these things are and what they do. And it's just such a big component of everything that you do later in life. But it's kind of ironic because a lot of people that I interviewed were telling me that you learn almost everything in residency at the same time. So you have to have that background information from med school and undergrad and everything, but all the procedures are mainly done and learned in residency. So it's an equal balance of both. So I don't have a mentor yet because my first choices were too far. My absolute first choice is Dr. Kim Rickert, the neurosurgeon that I was talking about earlier, but unfortunately she's all the way down in Parkland Hospital, which is in downtown Dallas. And my second choice was a surgical oncologist, Dr. Keith Cavanes, but he's also in the same area. And as much as I would love to go and shadow them, and they definitely were very open to it, it's just too far for me because on the same days I have to go down to Plano and back, and it would just be too much to go from Dallas, then back to Frisco, then back to Plano, and then back to Frisco. So I decided to keep on looking closer to Frisco and Plano. So as of today, actually, I decided that I was most likely going to ask Dr. Robert Minkas, the pediatric surgeon. That's him up there. He's at Children's Medical Center. And I think I chose him because he showed that he does the biggest variety in the surgery that he does, because everyone else that I talked to is extremely specialized. Like, for example, I didn't include this in there, but I talked to a surgeon. He's a general surgeon, but he does specifically like vein surgery. So he'll use lasers and he'll shrink down veins and it will take them out surgically. So that just goes to show how subspecialized everything is, that with Dr. Minkas, he has such a broad variety of things that he does every day. So I've decided to probably go farther on that path with him, and I know it's a definite yes because he told me that he would definitely love to do that and be a mentor. So that is all. I've learned so much from my interviews and research so far, and I hope to learn so much more. And that concludes my presentation. Thank you for listening.